2, 1, and we're live, ladies and gentlemen. Or gentlemen, you two. Ladies and gentlemen listening, but you two, unless you have some non-binary handle that you enjoy. It's a new world.
I don't.
Please introduce yourself.
Sure. So I'm Dr. Mike Hart, originally from St. John's, Newfoundland. Now I'm residing in London, Ontario, and I'm a family doctor. And I've been practicing cannabis medicine for just over 5 years.
And you, sir?
My name's Alex Berenson. I used to be a New York Times reporter. Then I became a spy novelist. And most recently, I wrote the book Tell Your Children, The Truth About Marijuana, Mental Illness, and Violence, which came out last month and has not endeared me to the cannabis advocacy community, I'd say.
Have they attacked you mercilessly for this book?
Yes, they have,
Yes.
and that's okay. I've also heard from a lot of parents, some users, but parents who've told me that the book really encapsulates their family's problems in the last couple of years.
I suspect my real thoughts here, before we even get started, is that we're going to find that the truth is somewhere in the middle here. I don't think marijuana is 100% safe, honestly, for everybody. I really don't. I know too many people that have had experiences where they took too much, particularly edibles, and I want to say I know anybody who had psychotic breaks, but I know some people that freaked out for weeks. In fact, we just had a comedian here from Brazil a couple days ago, Rafi Bastos, who said he took a couple of hits of a vape pen. He was high for 14 days. Went to a psychiatrist, and he's a big guy. He's like 6'5", 6'6". And they told him to keep taking it because he's like, you're so big, just keep smoking. And so he doesn't smoke, so he just kept hitting his vape pen. He said, I was high for fucking 2 weeks.
Yeah, so you need to do it properly, right?
Yes.
It needs to be held to the same standard as any other medicine. So
Yeah.
we need to identify that there's risks and there's benefits to it.
Yes.
Right? And some people are definitely, going to be more susceptible to those risks.
Yeah.
And we need to kind of, tease out those people and make sure that those people, don't put themselves at risk.
Yeah, I think so as well. And this is one of the reasons why I want to state this, because I'm a well-known marijuana advocate. But I believe absolutely there are great benefits to it. I think there's great benefits in terms of relieving pressure, ocular pressure for people that have glaucoma, people with AIDS who are on medication, people with cancer that are going through chemotherapy find great benefit in terms of helping them. And then there's also some people with autism. I know people that their children have autism, and they give them small amounts of edible marijuana and stop seizures. It's incredibly beneficial in the form of CBD for a lot of different ailments. But I think with all things, and this is a stance that I've kind of like really come to accept over the last few years, with all things that affect the mind, they affect everyone slightly differently.
Absolutely. Yeah. Alex, you want to say something?
No. Well, first of all, I suspect, there were people who said, don't go on with Joe. He's just going to, he's going to try to eat you alive. And especially it'll be 2-on-1. I told them the truth. First of all, I'll go on with anybody. And I am glad you had me on, or you're having me on, because, Bill Maher, he won't have me on. He's afraid to talk to me about this.
Why? What did he say?
Well, he told his people told the Simon & Schuster PR people, we just don't want to have him on. And NPR had a national NPR show had an interview scheduled with me, an hour-long segment, and they canceled it. They said we don't believe in the conclusions of the book. Okay, you don't believe in the conclusions of the book? Have me on. Ask me anything.
Yeah.
And that's why I'm so happy that you're not afraid to have me on, that we can have a conversation, Come at me with any question you want about the science. I'll say right off the top, I don't think marijuana is medicine. It has a few medical uses that have been, CBD has been shown to reduce seizures in kids. That's great. THC has been shown to reduce the nausea associated with chemotherapy. That's nice. But for the most part, people use THC and cannabis as recreational intoxicants. They use them to get high the same way they use alcohol, the same way they use other drugs. And the sooner we accept that reality, the better off we'll all be. That this is a drug and it has risks and benefits. And the risks and benefits are different than alcohol. They're different than other drugs. But I don't think if you look sort of on a population level basis, they're less than alcohol. I don't think you can even say that.
I really strongly disagree with that. And I mean, you just have to look at the death rate, right? More people die from alcohol than, almost all drugs combined. But when we're looking at cannabis, there's 0 deaths attributed to the use of cannabis itself. Sure, you could say, someone could use cannabis and jump off a cliff or something like that. But we're talking about the lethal dose. You cannot die from cannabis. And just based upon that alone, it makes it much, much safer than alcohol.
Yeah,
So
how could you say that if that is the case?
So that's a really good question. The normal number that's used for U.S. deaths from alcohol is about 90,000. Now, about 30 to 40,000 of those deaths are deaths from the physical effects of alcohol, right? Essentially liver damage, either chronic liver damage, you get cirrhosis, you die. In some cases, you can drink so much that you kill yourself in a night. So that's about 30 to 40,000 deaths. The other deaths are generally associated with alcohol, meaning somebody
Violence.
drank. Exactly. Violence, suicide, car accidents. And all those numbers are basically based on studies from the 90s and before, where people looked at traffic accidents and there were a certain number of those accidents where people had a blood alcohol content of higher than 0.1. They said, okay, that's an alcohol-associated death. That's a fine way to count as far as I'm concerned. Nobody has ever done that count for cannabis, and I can tell you based on the tox screens that I've seen from Colorado, where people had cannabis in their blood and committed suicide, people had cannabis in or I should say THC in their blood, and got into fatal confrontations with police officers. If and when we do this number for cannabis, which we need to do as soon as possible, the number's going to be a lot higher than 0. I suspect it will be in the 10 to 20,000 range. We won't know till we actually do it.
Okay, well let's eliminate. Let's go even over the alcohol. Let's eliminate all things like violence, and let's eliminate suicide, and let's assume those people would have committed violence and committed suicide without it. You're still looking at a giant number of people who drink themselves to death.
Yes.
Thousands and thousands and thousands of people every year versus 0 with marijuana. And you're aware, I'm sure, that correlation does not equal causation, and that especially in a place like Colorado, where you're dealing with cannabis, something that stays in the system for many, many weeks, if you're testing people and they test positive for marijuana and they wind up committing suicide or they wind up committing violence, they don't even necessarily have to have been under the influence of it.
Well, as you know, there's when you test the blood, you can test both the active metabolite and the inactive metabolite
Right.
of THC. So the test, when you do a blood test on somebody who's committed suicide, it's sophisticated enough to tease that out. So there's a lot of people who have the active metabolite in their blood. I agree. Alcohol is a physically toxic substance. Cannabis is a neurotoxin for a lot of people.
But in addition to the deaths, there's also just the morbidity that's associated with alcohol. I mean, it ruins people's lives. It ruins marriages. It leads to weight gain. It leads to a lot of metabolic disturbances.
I think you
right?
could say
So-
that for some people with marijuana too. I think you could say some people, especially weight gain, that some people smoke a lot of pot and they get lazy and they start eating Cheetos all day. and you could also say that with some people, the wake and bakers that, seem to be wasting their lives away. And that's like the stereotypical negative, when you're talking about a negative description of a marijuana user, it's the wake and baker, right? The person who's high all the time. You could absolutely say that could ruin relationships. You could absolutely say that would ruin your job.
You could, but again, too, we're using the term marijuana, and really we should be using THC or high THC when we're saying that.
Okay.
Because, people who use high CBD every day, as we know, or most people listening to this probably know that
Sure,
CBD
sure.
is non-psychoactive. It
Yeah.
does not get you high. So,
Super beneficial.
Yes.
that can be
Yeah.
extremely beneficial for, a variety of different disorders that people have.
Yeah.
So, we really need to be careful about using cannabis versus using, THC, because
Well, I
it's really
think-
the THC that can do that. And to your point, but you say like THC can cause the munchies, and of course that's not good for someone who doesn't want to gain weight. And just so people know, the way that it does do that is when THC attaches to the CB1 receptor, you get an increase in a hormone called ghrelin, and ghrelin can actually induce hunger, and that's why people get the munchies. But that is not necessarily a bad thing if you're someone who has cancer, or if you're someone who's wasting away from a terrible illness. So sometimes having the munchies is definitely a good thing. And I know a lot of people have said to me it's not available, so you should probably not talk about as much, but there is another cannabinoid called THCV. So, there's over 100 cannabinoids in cannabis. THC and CBD are only two of them. Those are the main ones that people know about. So THCV has been shown to actually reduce appetite. So if we can get that out there in the market, like we have with CBD, then we can almost, eliminate or potentially, substantially reduce the problem that people have with THC by using it with THCV.
Dr. Hart, I have a question for you. When people come into your practice, do they want high CBD products, or do they want to get intoxicated?
No, absolutely.
Well, in Canada, it's fully legal.
Sure, of course.
Yeah, so it's like if they don't need to go to him to get intoxicated.
Right. So you're seeing a population that is genuinely interested in the health benefits.
Absolutely, because I'm glad that that's legalized in Canada, because it does make my job a little bit easier, because basically everyone who's coming to me now, I know that they want to use it medically, because if they want to use it recreationally, they just go to the store, right? Because it's kind of a pain to, get in to see me, come in and have the discussion, all that type of stuff. So, the people who see me now, they're all using it medically. And then, to answer your question though, Alex, almost all my patients, as soon as they come in, they say, I don't want to get high. I don't want to get high. Like, that's almost what everyone says. So, I think the word is out there that, CBD is non-psychoactive and it doesn't get you high. And I think that a lot of people are really interested in that compound. And, if the people didn't have the success that they've had over the past few years, it wouldn't be as popular as it is. So, I think that, we do need to look at the scientific evidence, but we do need to listen to others. And the anecdotal evidence is, something that we should consider, because it is so strong.
Alex, let me ask you this. Why don't you consider it medicine when it has proven medical benefits?
Well, it obviously can be medicine for these narrow things that the FDA has approved it for. But as you know, I'm sure, when people talk about it as medicine, when the ballot initiatives that have gotten it approved as medicine have really essentially deceived voters about the process, right? So you go to a pot doctor, you get an authorization. That authorization essentially enables you to buy as much cannabis as you want for the next year. Most of the time, in reality, these doctors are not giving you a real medical examination. They're saying to you, hey, do you have pain? Do you have anxiety? Here's your authorization.
I don't think you should speak for every single doctor.
No, not
because
every. No.
We don't do that at my clinic, and I know that a lot of the clinics in Canada, anyway, we definitely do not do that. And we provide a lot of education at my clinic, and there's other clinics in Canada that also provide a lot of education.
And I imagine there's a spectrum, but in the U.S., this was and I spoke to advocates for my book. I spoke to Rob Campia, who ran the Marijuana Policy Project for a long time for the book, and he acknowledged, the advocates knew that this was a backdoor route to legalization in the U.S.
Yeah, I used to joke around about it. My doctor said, why do you need pot? I said, I get headaches. He said, when do you get headaches? I said, whenever I think about the fact that pot's illegal. And so he wrote me a prescription.
I mean, let's be honest about it. I'm not look, I say in the book at the end, I don't think this substance should be legal. I favor decriminalization. We're sort of jumping ahead here. But if it's going to be legal, I'd rather have it be legal for recreational use. I'd rather that we don't pretend that THC high cannabis is a medicine, and I'd rather separate out doctors like Dr. Hart.
THC is a medicine, though.
But why are you saying don't pretend? Because there's many medicines that have horrific side effects.
Sure.
The medicine THC in regards to children's autism is pretty significant and well documented. Epilepsy, autism, those are two huge things that happen with children that they've been shown to severely mitigate with edible marijuana.
So I have to push back on you a little bit. CBD has been shown to reduce seizures in children with epilepsy. It's FDA approved for that.
Maybe anecdotal, but I have a good friend who has a child who he uses it on, and he showed it. It's been a game changer.
Yeah, so let me interrupt for a sec. So, I had a patient 4 or 5 years ago, and she was 20 years old. She couldn't drive a car because she had seizures, right? So you can imagine being 20 years old, not being able to drive a car. All your friends are driving around. So she uses a little bit of CBD, not even every day. She's never had a seizure since.
Okay, but I
and
think
now she's able to drive her car.
But we're talking about CBD. He's talking about THC.
So you're talking about a case, okay? And I'm not saying that your friend's situation didn't happen. I'm not saying it's not real. What I'm saying is that the reason we have clinical trials is because science, the way you know whether a medicine works or not, whether a chemical compound works, whatever that compound is, the best way to know is you give it to two groups of, you give the real medicine to one group of people and you give a placebo to the other group. And you see the changes in those two groups over time. And you find out whether or not your theory about whether this works on a population level basis is real or not. That is at the core of medical science. And we've basically thrown that rule out for THC.
Well, that's not entirely correct. You do know that were studies that were run during the Nixon administration that showed the efficacy of marijuana and the safety of it, and those were all squashed. And you also, I'm sure like when we're talking about marijuana, you're talking about something that's federally illegal. It's
Yes,
not
of
something
course.
that's easy to run these FDA studies on.
Yes, and I do, and I say at the end of the book, I think we should drop that. I think anybody who's got a legitimate interest in researching either THC or cannabis or any of the compounds for a medical condition, let them run phase 1, phase 2, phase 3 trials. Let's see if this plant is good for these things.
I think that's a great idea. But still, why are you saying that you don't think it is medicine when all these people find benefit in it?
So
Do you think they're getting it from just the CBD, the minimal amount of CBD in marijuana?
no, I think that again there's been a lot of research done on THC and cannabis to see whether or not whether THC is a compound and whether smoked cannabis can treat these conditions. And for the most part, the studies have been negative. There's
Negative in what way?
meaning they haven't shown any actual
Can you cite these studies?
I mentioned them in my book.
Okay. Well, what were the conclusions of these studies when you're saying that they're not positive?
That they didn't work. That the drug
Didn't work on what?
on cancer, on Alzheimer's disease, on irritable bowel syndrome, on all kinds.
So, Alex, I mean, you're throwing a few different things out there, and I appreciate the fact that we can't be going around, saying things like, cannabis cures cancer, right? But
Yeah.
and I've done videos on this even like recently, stating that. But if you look at the research, I mean, specifically, if you look at specific cancers, there are studies that have shown that THC and CBD can help. Like, say if we're talking about breast cancer, and I did a video on this recently. If you are HER2 positive and you use THC and CBD, it can in fact reduce tumor size and it can reduce tumor growth. Now, if you have
I'm sorry, can I interrupt
Sure.
you? What does that mean? What is
it's
it?
a subset of breast cancer.
Right. So there's different types of breast cancer, and that's just one subset of breast cancer. So there are other breast cancers which do not express cannabinoid receptors. And I've seen one study, at least, again, it's only one study, that showed that when they gave THC in that animal model, it actually caused a proliferation of tumors. So it worsened them. So, I do agree with you, Alex, in the fact that, we have to be careful about using, terms like that. But that just doesn't mean that we can't say that cannabis is no good for cancer at all. And I mean, even in the National Academies of Science and Engineering report, they said that cancer was great for chemotherapy-induced nausea
Yes.
and vomiting, right? So, it's definitely a really good medicine for a lot of different things. And when we're talking about THC, I said earlier, of course, we need to be careful about THC, but it definitely is still a medicine. And to your point with regards to it not being a medicine, say for something like PTSD, I come from it from a clinician's point of view. So I'm not a researcher. So I need to make sure that my patients are getting better. It's very frustrating for me just to say to someone, "Oh, there's nothing I can do for you. There's nothing I can do for you." So, and I understand that doing something sometimes is not going to be beneficial just because you're doing something. You have to do something that actually works. But, we do have epidemiological studies, and we have other studies that have shown that, when patients are given cannabis, it can reduce their symptoms of PTSD. There's also another study, I don't use this drug too often, called Nabilone. So Nabilone is just pure THC. Nabilone was shown to reduce nightmares in people who have PTSD. So, it's just saying, just because THC is psychoactive doesn't mean that it's not a medicine. And just to keep on the topic of PTSD, in addition to that, we've identified mechanisms of action. I know there's one study. I think Matt Hill was on was one of the authors of that study, and he noted that in people who have PTSD, there's an over 50% decrease in levels of anandamide. So anandamide,
which is the naturally occurring cannabinoid in your brain.
Which is a naturally occurring endocannabinoid, correct. So you can get that through exercise, which is one excellent way to do it. And that's part of the high that you get after you exercise. But the other way that you can get it is by using cannabis. So when THC attaches to those CB1 receptors, you can get a release of anandamide, and cannabidiol can actually increase anandamide by another mechanism of action as well. So there's different ways where we can raise a level of deficiency. So to me as a clinician, if I have someone who is not doing very well, they've been on a bunch of different medications, I've identified that they have PTSD, we have a mechanism of action, we have studies, and then again too, don't discount my clinical experience, right? I've been working for over 5 years, just with cannabis. I mean, I do other medicines, prescribe other medicines as well, but I've been doing cannabis medicine for over 5 years, and there's a lot that I've learned, right? So as much as I've learned, through reading studies and through going to conferences and things like that, for sure the best resource as a clinician is to learn from your patients and to hear what your patients tell me. And the things that my patients tell me is that THC is really effective for the sleep at night. And a lot of my patients, especially my veteran patients, have done really, really well with that. And just one further point too, there was, I know it was in 2015, I believe it was, there was a meta-analysis done, I can pull it up if we need to, that indicated that, a lot of the medicines that are being used now for PTSD are just simply ineffective. And the other thing too is that there's never been a medicine made specifically for PTSD. So all the medicines that people are using are for anxiety, or they're for depression, or they're for insomnia, or they're for something else. But when we look at like a study that says people with PTSD have a lower level of anandamide, and then if you can increase that level of anandamide, that's a good way to treat someone. It doesn't matter whether it's a vitamin, whether it's a hormone. As long as you are correcting a deficiency, you're generally going to get excellent clinical results.